A warm welcome and a very pleasant morning to all the respected doctors, researchers, and delegates gathered here. It's a pleasure to welcome you to the day 2 of JPEF 2025. Yesterday set the tone with powerful ideas and collaborative learning, and today we continue that journey with equally engaging sessions designed to inform, challenge, and elevate our understanding of diabetes care. To begin, I now invite our chairpersons to take over the first session. Dr. Jaylekshmi R. Kurup, Senior Medical Officer, Cochin Port Hospital, Kochi. Dr. Thankam D, Physician, SK Hospital, Trivandrum. We are honored to have you with us.
Good morning. Uh, we are starting the first session, that is online. Um, the subject is extrinsic factors obesity. The speaker is Anil Bhoraskar. He is a diabetologist.
Yeah. Can you hear me?
Yeah.
Okay.
Good morning, sir. Can you hear?
Yeah.
He's a diabetologist at Grand Medical College, Mumbai. He has got fellowships in FRCP London, FCIP Fellow, College of Physicians of India, etc. Over to you, sir, for the discussion.
Yeah. Now, today we are going to talk. Am I audible?
Yes, sir.
Today we are going to talk about very interesting aspect about obesity, and that is to tell you the problems of obesity, which are really a big menace in our society, right from childhood to adulthood. You'll also realize that obesity is as bad as cancer because it not only predisposes to heart disease, but later on it can lead to cancer. And that is what we are all worried about. Next slide, please. Next slide. Yeah, you'll have to do it for me. I can't do from this end. Put on next slide. Next slide. See. Next slide, please. Yeah. Now you realize that obesity is not a very simple problem to solve. There are multiple problems which we are faced, and there are many options today available. You'll realize the options are quite simple to common man, but when it comes to specialties, it becomes a difficult thing to manage. So, what is the approach to the management of hyperglycemia? First is a patient with diabetes. Now, the disease duration. The disease duration is also very important. You realize that if the disease for a long standing, then we are faced with multiple problems. These are very serious problems, and the problems multiply with comorbidity. Every diabetic over a period of 30-40 years does have some element of nephropathy. You'll realize that. Next slide, please. Next slide. You see, from my own experience, I will tell you from 50 kg in the school in the last year of the uh, my inter science, I was weighing 50 kgs to 60 kg in 1976 to 85 kg in 1980 to 100 kg in 1998 and 123 kg in 2021. This was my journey to obesity, and the main cause of obesity was obviously, next slide please. So what are the extrinsic causes? Next slide. This is how my wife used to look when I got married. Next slide. And this is how I used to look when I was in a military school. Next slide, please. And this is my daughter from Australia, and she came to India only to eat this Kutub Minar dosa. And look at her, she's so slim. And this is how we look now, me and my wife. Next slide, please. And this is the kind of a diet all of us used to eat, unfortunately forced to eat. Next slide. Look at the type of food that we have. India is a country of plenty. Next slide, please. Next slide. Next slide. Now, these are all very leading diabetologists we made for a conference, and look at the number of dishes that we ordered. And the same diet is taken in all conferences, and after each conference, people tend to get 1 kilo or 2 kilo of weight. You'll realize this is the cause of, and we were wondering what are the weapons of mass destruction. These are the weapons of mass destruction. Next slide, please. Next slide. Next slide. Next slide. Next slide. Next slide. Batade vada, bhajia, and look at this. The real enemy. Next slide. The weapon of mass destruction. Look at this. Next slide. Samosas. Ah, this is a Big Mac. And now I'll tell you what are the calories it has. Next slide. Next slide. Each serving of this, it gives you 540 calories. Fats of 25 grams, cholesterol of 80 milligram, carbohydrates of 46 grams, salt of 940 milligram, and protein only 25 grams. So this is what the children eat. And therefore, how do you lose weight? The only way to lose weight, not the drugs, not the high-fi drugs which have come in the market. The effect is seen after 1 year. The real remedy is strict diet control and exercise. Next slide, please. Now, prevention of complications. First is, what is the cause of obesity? It's a disease. People realize that obesity is a disease. It's not just being overweight or chubby cheeks. No, obesity is a disease. And how is the management? Management is multifactorial. Next slide, please. Next slide. Now, obviously, definition and classification of obesity varies from center to center. You realize that it's very difficult to define obesity in terms of severity. Your first thing is classification of obesity. Underweight is less than BMI less than 18.5, normal is 18.5 to 25, overweight is anything between 25 to 30, obesity anything more than 30 is definitely obese, obesity class 1 is more than 30 and less than 35, 35 to 40, and is morbid obesity is more than 40. Now, international BMI classification, underweight less than 18, overweight more than 25. Ethnicity and specific cutoff of waist circumference as a measure of abdominal obesity. European more than 94 centimeters, South Asian 90, Chinese 90, and we are all called as thin fat Indians. Why? Because of the BMI of 21, our waist circumference is 105 centimeters. So we are all obese down. You realize that. Next slide, please. The mean global BMI in 1975 to 16 has been steadily increasing, as you can see. Obesity rates worldwide are increasing. All over the world, the obesity rates are increasing. Next slide, please. And you'll see the women are getting more obese than men. Next slide. Now, it is a disease, and basically, obesity is a complex and multifactorial disease. Simple. Energy intake is more than energy expenditure, you'll gain weight. If you need 1200 calories for your day to day expenditure and you eat 1600 calories, these 400 calories are going to go into weight. And obviously, it has got a multiple areas to intervene: adipose tissue, pancreas, gut, and all these things. Now, inactive lifestyle, smoking, cessation, and psychological factors. These are all factors. Gut microbes also play a major role. Insulin sensitivity, obese gut microbes increase. It has got action on brain. The brain must be satisfied. Increase satiety, decrease LPS inflammation, decrease lipogenesis, increase PYY, GLP-1, muscle increase fatty acid oxidation, and this will all become insulin sensitive subjects, and they become lean gut microbiota and obese gut microbiota. So the microbes in the gut also play a role. Obesity associated multiple comorbidities, everyone knows: metabolic, mechanical, and mental. Metabolic, of course, people know: asthma, fatty deficits, gallstones, infertility, cancers. Cardiovascular disease, everybody knows: strokes, dyslipidemia, hypertension, coronary artery disease, coronary heart failure, pulmonary embolus. Type 2 diabetes, pre-diabetes, increased chances of thrombosis, and increased gout. You see, the serum uric acid for Caucasians, the normal level is 6, but for Indians it is 2. Anything more than 2, you are likely to develop uric acid problems, and that also increases with obesity. Sleep apnea, another big problem with obese people. Obstructive sleep apnea, which can predispose to cardiovascular disease, stroke, dyslipidemia, hypertension, coronary artery disease, chronic back pain, and this is very, very serious and can be managed. Now, management, clinical management of obesity, diet, physical activity, and behavior therapy. Most important, behavior. Today, the obesity is handled by psychologists. People who are depressed tend to eat a lot, or they eat, keep on eating, munching. Another enemy is TV. You sit in front of a TV and keep on munching stuff, which is usually all packeted food, which are extremely harmful. Now, obviously, options are either pharmacotherapy or surgery. Pharmacological management of obesity, the endocrine society clinical practice guidelines: BMI more than 25, diet, exercise, and behavioral modification. BMI more than 27 with comorbidity. Patients with hypertension and cardiovascular disease must be treated separately. Avoid sympathomimetic agents, phentermine and dithapropine. Try low carb serine and orlistat. Use of anti-diabetic medications that have additional actions to promote weight loss, such as GLP-1 analogs or SGLT2 inhibitors, are also very useful because they cause volume contraction. In addition, the first line agent, type 2 diabetes to obesity. BMI more than 35, diet, exercise, behavior, pharmacotherapy, and bariatric surgery. Treatment option for people with obesity, you'll realize that. Next slide, please. Next slide. Next slide, please. Next slide. Treatment option, yeah. Come to treatment options. Treatment options. Yeah. Next two slides. Now that's right. Stop here. Now treatment options for people with obesity, lifestyle modification doesn't work. Pharmacotherapy plus lifestyle modification. Then comes gastric banding, gastric sleeve, gastric bypass. Now, luckily, there are some drugs available today which are now quite popular, semaglutide and uh, tirzepatide. These are the drugs which have come in the market recently. I am not very familiar with the use of this drug because our experience is only for last 2 to 3 months. But they give an option with a considerable weight loss and loss in inches. It's not only the loss of weight, but loss in inches also is very rewarding because that is what we are really looking at. Next slide, please. The treatment gap in weight management achievable by diet, exercise. Next slide, please. Achievable by diet, exercise, intensive lifestyle modification, and a current treatment. The gap is achievable by bariatric surgery, laparoscopic gastric binding. So these are all extreme cases which very morbid obesity. The patient can't move. There are so many problems. But the post-operative management of all these surgeries need a very aggressive teamwork between endocrinologist, cardiologist, nephrologist, all the. It usually is achievable in a big centers like Raj Hospital. Next slide, please. Weight loss varies depending on intervention. Now you'll realize only advice alone, hardly. Exercise alone, not much. What works the best is a diet, exercise, and low energy diet, and very rarely combination of drug. But diet and exercise is the cornerstone of treatment. Whatever you do, diet and behavioral intervention,
Hello. Hello.
initial weight management. Next slide,
Excuse me,
please.
sir.
Yeah,
Time.
yeah, another 2 minutes. That's it. Low calorie diet, modified diet. Next slide, please. And the pharmacotherapy. Next slide, please. Next slide. Yeah. Now, I'll tell you roughly diabetes and hypertension I had since 2000, AFib since 2000, stopped alcohol, lost 10 kilos, got bilateral TKR done, lost 5 kg, and lost major weight in the pandemic. Now, diabetes and quality of life. Next slide. Next slide. What causes clinical inertia? This is a problem. The clinical inertia is caused initially by not approaching the doctor properly. And that is what you have to avoid. And you have to have a healthy lifestyle. Next slide, please. And it starts affecting the quality of life. You can't interfere, you can't enjoy sports, you can't enjoy outdoor activities, you can't go for dances, you can't have functions if you've got a knee joints affected, if you're obese and you're not able to move.
Sir.
So healthy lifestyle is the last slide. wrong diet in practice. Please say that this is not, you are not supposed to eat. Wrong diet.
Excuse me, sir.
Yeah,
Time is up.
that's it. Thank you very much for your kind attention.
Thank you, sir. You have very well explained the extrinsic factors of obesity. Now it is time for us to give awareness to our population regarding obesity. Obesity and diabetes are the two modern epidemics. Obesity leads to diabetes and fatty liver. I am doing monthly camps and doing fibroscan for patients, and I could detect fatty liver in most of the patients. So it is our duty to give awareness regarding the obesity and diabetes. Thank you, sir.
Thank you very much.
If there are any questions, no. Have you got?